LJARI Alcohol is a company I started approximately 19 years ago to make a better machine than what I was trained to use in the field of neuroscience. I was introduced to Catherine Riviere of the Salk Institute. She said, I believe that we can get a grant for what you're talking about doing. She always pushes me to stay outside the box. She's always believed in me in that kind of a way.
I was involved in alcohol research at the Salk Institute as well as at Scripps Institute, and we needed instrumentation to expose laboratory rodents to alcohol as much as to other drugs, and none of the equipment that we had really fulfilled what I needed from an experimental point of view. Maury Cole was working in the lab at the time, so we got together, and because he has such great engineering skills, he was able to conceptualize new instruments, which he then started to build. We did a lot of experiments to demonstrate their reliability, and we started publishing results with them, and that really started the company because our colleagues wanted these instruments to do their own research. So more recently, LJARI Alcohol Research really left the alcohol-only field to start working with other drugs. First, we started with nicotine because a lot of people drink and smoke at the same time, and it was very important to study the effects of the combined drugs on the brain. Then Maury in particular realized that we needed to incorporate what's called street drugs. We started developing instruments that allow us the concomitant administration of whatever drug protocol we wanted. I'm really excited about the educational program. I think it's absolutely unique. Maureen realized that there was really a great lack of education, drug-based education in the school system. And one of the problems was that young students could really not conceptualize, visualize the effects of alcohol and other drugs on the brain and on the lungs. And we thought that if we could bring models that would allow them to really visualize the consequences of those drugs, it would both educate them and also made them very careful regarding the effects and the consequences of those drugs on their brain and their lungs.